everyone, and welcome. Today, we're diving into something that's a real game changer for frontline healthcare workers. You know, the ones who are absolutely pushed to their limits. We're talking about a tool called Lesedi AI. And to really get why it's so important, we've got to start right where the action is, on the ground, at the clinic. So, let's meet someone at the heart of this story. Nurse Naledi. She's working at a small clinic, and, well, things are getting tough. The pressure on her and clinics like hers is just massive. The whole system is strained, and she's right there in the middle of it all. Okay, so what does that strain actually look like day to day? Let's break down exactly what she's up against. I mean, look at this. It's really a perfect storm, isn't it? She's wrestling with clunky, outdated systems. The official guidelines, they're hundreds of pages long. On top of that, you've got funding cuts, which means fewer staff and longer wait times for patients. And all of this leads to a huge problem. More people are falling through the cracks, what's known as interruption in treatment. Basically, they stop their care. So it all boils down to this, right? How can one person, one nurse, possibly manage all of that? You've got these incredibly dedicated people like Naledi who are up against systemic failures. It's just not sustainable. Something's got to give. Well, Naledi's clinic decided they had to do something different. They brought in a new tool. And the goal here wasn't to add another complicated system to the pile, but to actually cut through the noise and bring some clarity. And that tool is Lesedi AI. Now, the key thing to understand is that this is a proactive tool. It's not here to replace Naledi or her expertise, not at all. Think of it more like a super smart assistant. It crunches all the data in the background to flag patients who might be at risk before it becomes a crisis. And then it gives her clear, actionable things she can do about it. Okay, that's the big picture, but how does this actually work in the real world for Naledi on a Tuesday afternoon? Let's get specific and look at how it helps with one of her patients. So, the system sends an alert about her patients, Lorado. On paper, Lorado seems stable, but the AI spots something. It connects two seemingly separate dots. One, she's missed a couple of medication pickups, and two, a note in the system shows she recently lost her job. Now think about it. For a busy nurse like Naledi with so many patients, it would be almost impossible to piece that together herself. But the AI, it sees it instantly. And this right here shows you the huge difference. The old way was all about reaction. You'd have to dig through charts manually, basically guessing who might be in trouble. The Lesedi AI way, it's all proactive. It gives you automated flags based on real data. So Naledi isn't just reacting to problems after they happen, she's getting ahead of them. And really, this is what it's all about. For Naledi, it means she's spending way less time buried in paperwork and chasing down data, and way more time doing what she does best, actually caring for people like Lorado. It's about giving her back the time for that human connection. But here's where it gets really interesting. This isn't just about helping one patient at a time. The impact doesn't stop at the clinic walls. It actually scales up. So now let's zoom out a bit. We're going to look at this from the perspective of the clinic's operational manager, Refuwe. Her job is to see the bigger picture, not just one patient, but the health of the entire clinic. So Refuwe logs into her Lesedi AI dashboard, and this is what she sees. A really worrying trend. That interruption in treatment rate, the number of people falling out of care, it's been creeping up over the last few months. What Naledi was feeling with her individual patients, Refuwe can now see as a clear system-wide problem. And again, the AI doesn't just say, hey, you've got a problem. It gives her a roadmap. First, it identifies the trend. Then, it helps her focus by generating a list of the most high-risk patients. And then this is the amazing part. It actually suggests a plan. Things like, hey, maybe we should bring back those adherence clubs, or what about introducing fast-track appointments? So Refuwe gets a solid, data-backed plan that she can approve and put into action right away. And it doesn't stop there. The power of this system scales up even further. So now let's go one level higher, to the district manager, Mfu. He's responsible for a whole bunch of communities, not just one clinic. For MPO, Lesedi AI becomes this incredible bird's eye view. It can identify specific communities where a lot of patients are disengaging, but it goes deeper. It connects that trend to something else, a high number of migrant workers in that specific area. It even helps create these social profiles so he can understand the different kinds of people living there and what their unique challenges might be. And that insight, well, it changes everything. Because now you can stop trying to force people into a one-size-fits-all clinic schedule that just doesn't work for them. Instead, you can design care that actually fits their lives. The care starts to follow the people, not the other way around. And the suggestions that come out of this are so practical. So if people are working and can't make it to the clinic during the day, maybe the answer is to expand mobile clinic services. Or what if we set up external pickup points for medication near bus stations? You could even implement treatment programs right at major workplaces. It's about meeting people where they are. All right, let's pull all these threads together. We've seen how this works for a single patient, for a clinic manager, and for a whole district. So what's the big takeaway here? What Lesedi AI really does is connect all the dots. It creates this amazing virtuous cycle. An insight at the huge community level, like identifying a migrant worker population, trickles down to inform the strategy at the clinic level. And that strategy empowers a nurse like Naledi to give better, more personal care to someone like Lorado. Everything is connected. And that leaves us with a really powerful final thought. We've just looked at how this can transform things in one district. But just for a second, imagine scaling this up. What if every health system, everywhere, could connect the dots like this? What if they could all turn scattered pieces of data into real, coordinated, and compassionate action? Just think about what we could achieve then.